the personal effects on a person with mental illness. If you stay to the end of this slideshow, you will have a better understanding of the past, present, and future of mental illness. Discover the hope of a life without the emotional and thinking challenge of mental illness. In the beginning, mental health issues is a course life of disruption for the rest of your life. In the middle, it is a struggling ground. One has to deal with mental health treatment. Above and beyond treatment, life changes and has hurdles. At the end point, with hope, people recover to a degree of lessened crisis and fewer frequency of breakdowns. During this part of life, mental illness becomes a normalcy. There is a degree of resolution. What would you do if you were struck with a lifetime disability? If you contracted a disease at 17 years old and were destined to a life of a medical condition, how would you live your life? Mental illness happens at any age. There is no cure. It is like a terminal physical disease. It is a broken brain. Maintaining a sense of being sane and normal is the journey of life. In this life course, you will have to deal with prejudice and discrimination, stigma. Your life struggle includes medication, therapy, and sad to say, unemployment. The stigma of mental illness keeps the public and employers from treating you with respect and compassion. Stigma makes life an uphill battle. How does mental illness start? There are many theories, but no one reason. It could be caused by too much stress. Brain chemicals can cause a brain to malfunction. A person's genes could bring the mind into an unbalanced state. Why does mental illness happen? There is no reason, only conjecture. Mental illness hits people at random. It is not a payback from something you've done. In history, a person with a broken brain was cast out from society. Jails were holding places to keep the public safe from imagined danger. At the point of the beginning of psychiatry, cottage hospitals work well. They were homes with few patients and had an environment similar to a hospital. These small healing communities turned into institutions, psych hospitals, housing scores of wards and thousands of patients. That was the standard. In the present, we have deinstitutionalized mental health hospitals. Medication and therapy is the course of stabilizing mental illness's walk of life. Community has changed from huge hospitals. Still, there is casting out of mentally ill people, and jails are places for the mentally ill. Families extend care for members who are struck with a thinking and emotional disability. When families cannot care for a person, adult foster care homes are an option. In an AFC home, the dream is for independent living. From the dream is a nightmare. There could be life on the streets or a commitment to the criminal justice system. Waking from this dire sleep, in the future, there may be a cure for mental illness. We can improve a broken system. We may evolve as a species to a state of cultural sanity. The wonderful imagined miracles of the mentally ill could become real. Tragic brain disease, surgery, like lobotomies, was a mistake. In the future, there may be psychic healing, positive thoughts and suggestions that may develop into a psychic healing state. Those are some of the hopes in the end to a brain disease. It is a can-do situation. We can do it. Along the way, we need to emphasize compassion for the lives of people with a no-fault brain disease. Humanism is a compassionate approach of care for our fellow man. We all desire a life, a quality life.